Hello and welcome back to the YouTube channel. Today we are talking about peripheral nerve stimulator. So there's a number of applications for peripheral nerve stimulation. It could be used for multiple different joint pains, and there's a number of different technologies out there. What's really interesting about the new technology is that the battery now can be externalized so that you can implant a device with a remote and basically the battery can go on the outside. So as you can see here, what you're implanting under the skin ends up being a whole lot smaller. Now the trade-off there is with the external battery, you're essentially wearing it on the skin. So that disc you see is obviously removable, but the battery is now on the outside of the body. And that is sending the power to the stimulator, which is under the skin. The lead placements are usually done through a needle. These are percutaneous, so very, very small incision. And in a minute, we'll talk to different body parts we can cover here. So once we get the stimulator leads in this case, it would be for somebody with low back pain. We mark the skin and then tunnel it over to the external battery. So those wires will come underneath the skin and be implanted underneath with the battery device. So that is the size of the battery. It's literally about the width of your finger. It's a very minimally invasive procedure. It can be done in about 30-ish minutes with minimal pain afterwards. So this is a nice minimally invasive technique. Let's talk a little bit about what body parts you can cover with peripheral stimulators. So the use cases for the stimulator include shoulder pain, neck pain, low back pain, hip pain, knee pain. So there's quite a few targets that are amenable to peripheral nerve stimulation. Now, when would I not opt for a peripheral nerve stimulator? If I think it's something coming directly from the spine, a pinched nerve, a failed back surgery, a condition like complex regional pain syndrome, those are traditionally treated with the spinal cord stimulation, and you can refer to some of the other videos on here that cover spinal cord stimulation. But axial low back pain, so there are implants that can be placed in the lower back that just treat muscles in the lower back. I've had good results with sacroiliac crest along the top of the hip bone. There's the superior cluneal nerves, which can be targeted there, and that helps to treat posterior hip and buttock pain. We can implant these for chronic knee pain, even in patients who've had total knee replacement. And additionally, shoulder has been a very popular target for these peripheral stimulators as well. Much like the permanent stimulators in the spine, this would be preceded with a trial. So you would do a trial with the external battery, meaning these wires would be out of the skin and not permanently implanted during the trial. If patients do well with the trial, then we go to the permanent like you see here. So that's the brains of it. It's a very small device. It's about the size of a quarter, easily placed under the skin. And it's a nice option for patients with chronic pain that don't want a big battery implanted. So again, this is more for your either peripheral nerves or joints, something that you wouldn't feel targeted in the spinal canal itself. And again, this is something we would usually trial before we go to a permanent one. So I hope this is helpful. If you have any questions or comments, please let me know below, and we will try and answer your questions. Again, please like and subscribe. That always helps that other people get these videos pointed to them. Thank you.